Hi, class. I'm really sorry I'm not going to be here Monday. I had some family things that came up. But what I would like you to do before we get started on some case studies is either grab something to write with, a pen or pencil, and a piece of paper, or open up a document on your computer to answer some of these questions that we're going to go over today during this case study. So, I will let you know when you need to be answering a question. And just make sure in your document, that you put what the question is and then what your answer is. These don't have to be long answers. They can be pretty short if it seems appropriate for them to be short, okay? I also want to encourage you all to talk with each other during class, even though I'm not there, if you need to. You should all be starting this roughly around the same time. So pause things if you need to and chat amongst yourselves to or with your neighbor or whatever works for you, okay? So we're going to talk about some GI and respiratory case studies. Now, just for ease of things, I'm not going to put this in full slide view. Try to get creative. So just make sure that's not what I wanted, that you've got your things open. The other thing you can have open, right, is your GI and respiratory flow chart that you did, right? This is helpful whenever we're talking about these case studies. That's the whole point of having these. Okay, so we have Lon, who has a history of GERD, is taking an over-the-counter acid reflux medication. Lon's vitals are a pulse of 68, respirations of 14, and a blood pressure of 100 over 68. You don't need to write this in your answers, but I want you to think, and you can talk to each other if you want, about whether you're going to see Lon. Are you going to see this patient? Is there any signs that you wouldn't see this patient? Taking all those things into consideration with Lon's health. So, if you're shaking your head while you're listening, yes, that you're going to see Lon, definitely, right? Very healthy otherwise. But we may need to take some things into consideration with Lon's history of GERD. So, what are some of those symptoms of GERD, right? What are some things that you might need to be aware of? There's like acid reflux is a symptom of GERD. There are some others that you've probably read about in your book. So many symptoms of GERD that you can think of. You want to add those, right? Think of GERD. There's definitely like acid reflux. They can have erosion of the teeth. That can be a symptom or a cause, right, of GERD, something that we would notice as a healthcare provider. I don't want you to overthink these. They may have a hard time swallowing, those kind of things. Okay? And then add any others that come to mind or that you remember from your reading. So, what is an emergency that could occur during this appointment that's most likely? And when I say emergency, we don't necessarily mean, like a really drastic emergency. This could be something that's subtle, right? It's not like life threatening. So think back to your flow chart and your reading. So a common emergency type of situation, I hate to call it emergency because it's not, we're not going to have an ambulance show up, is that a patient could experience some choking or they may just complain if you lean them back too far, right? So choking could possibly occur. So in this emergency, right, this isn't a life or death emergency, but what are some prevention strategies? And these are things that we should be answering, right? What are some symptoms of GERD? What is an emergency, most likely emergency? And then what are some prevention strategies, right? So a really easy one that can come with a patient that has GERD is just not leaning them back as far. And so, as the provider, we might have to adapt a little bit more. This is where using your mirror is going to be really critical while you are working on your patient and providing care, because you may not be able to lean them back, especially for some of those maxillary positions, right? We can use our saliva ejector a lot. And also provide water to the patient. So, for example, I've had patients over the years that have had GERD. This isn't uncommon. A lot of times they don't like to be leaned back far, which can be challenging and sometimes frustrating. So, sometimes as a clinician, as their provider, I'll even do stand up dentistry, especially if they can't lean back a lot. So, this way, I'm not sitting and like having my arms up above my shoulders trying to provide care. So I can have them sitting semi upright in that semi supine position, and then I use my mirror a lot. Now it's still not ideal on that maxillary arch, especially, but it does help me. And then I just try to be as quick and efficient with my appointment as possible. And then, of course, I try to communicate with my patient, right? So you don't have to list all the prevention strategies, but list 2 or 3. So, what if reflux is experienced during care, right? They actually have like reflux. How would you best manage it? So just think to a scenario, right? You have a patient even lean back, fairly normal, and they've experienced some reflux. They might be coughing a little bit, or they may, even kind of sit up partially really quickly. So in a scenario like this, and I want you to write down some things that you would consider, right? This doesn't have to be lengthy in what you're writing, but we'd probably sit our patient up, right? And offer them some water, like out of a cup, not like, here, let me squirt this water in your mouth. Now, some patients may be fine with that if you're squirting water in their mouth from the air water syringe, but a lot of people want to have a cup. We want to reassure them, right, that it's fine, it's not a big deal. And then also we're going to communicate with them again to make sure that they're okay to continue on with their appointment. Maybe they don't want to continue on. Maybe they would rather reschedule, especially if they're maybe in for a long period of time. But in my personal experience as a dental hygienist, typically people just need a second to kind of gather themselves, and then maybe we won't lean them back as far, right, as we had them in. And then we may also talk with our patient about maybe the best time to see them next time, right? Like maybe we shouldn't see them right after lunch. I know one of the prevention strategies, right, that's talked about in your book is like scheduling more than 3 hours after a meal, which is a good concept. However, that makes for a very small window of opportunity to see somebody, right? In kind of your traditional like working hours, because you have possibly breakfast in the morning and then lunch in the middle of the day. Like when do you have a 3 hours after a meal? So it may be something you talk with your patient. You also don't want them to avoid eating before they come in, right? Because that can then create other potentially much more problematic actual medical emergencies like syncope or hypoglycemia. So you can talk with your patient though. Maybe they have a better time of day. Maybe morning's better for them and you're seeing them in the afternoon, or afternoon is better and you're seeing them in the morning. So it can bring up some of those conversations on scheduling, right? So that would be like management in the moment that's also helping to lead to prevention in the future of this acid reflux type of occurring. So our next case study is on a patient named Twee. Twee is 19. Twee has a history of asthma, and she's used an albuterol inhaler. That's what she carries on her, but she hasn't used it in about a month. She does have seasonal allergies, and she's currently taking Claritin or Allegra. She can't remember which one. She takes both. Her vitals are a pulse of 72, respirations of 12, and blood pressure 110/62. Now, you don't need to write this one down on your paper, but would you see Twee today, or would you reschedule her? I'm assuming most of you are shaking your head up and down because, yes, of course we'd see Twee. Twee has a history of asthma. Twee has her albuterol inhaler with her. She doesn't have to use it often, recently anyways. She's taking some sort of allergy medication, not a big deal. And her vitals are very healthy and within a good range. So after administering some local anesthesia for Twee, she's having some dental work done for a restoration. She received lidocaine with 1 to 100,000 epinephrine, and the restoration has begun. Twee reports having difficulty breathing and says that she feels like an asthma attack is coming, right? Because Twee does know she's experienced asthma attacks before, so she has some knowledge. This isn't her first asthma attack. So what should you do? Now remember, I told you that Twee has her inhaler on her, right? She's 19, she carries it with her, even though she hasn't had to use it recently. Her mom makes sure that she always has it. So what's going to be the first thing you do, right? Always the first thing we do. We're going to stop whatever we're doing, right? We've talked about this before. This is like just 101 best thing to do. You're not going to keep going. Oh, you'll be fine. You'll be fine. Just lay down. Nope. We're going to stop what we're doing. Then what are we going to do? Are we going to leave our patient leaning back, or are we going to sit Twee up? Probably going to sit Twee up, right? She's having an asthma attack. She doesn't want to be laying back. So we're going to sit Twee up into an upright position. Now, Twee has her inhaler in her pocket, right? She may be already reaching for it. We can encourage her, and help, just reassure her and say, like, let's take a couple puffs of your inhaler or a bronchodilator, right? But most likely we're going to call it an inhaler with our patient. Since Twee has a history of asthma, she may know what a bronchodilator is, but it's an inhaler to most all of us. So Twee's gonna take a puff of that inhaler. Now, what else is happening though in the background, right? In our CNCC protocol, you don't have to write all of these down, but remember, right? So we've initiated that emergency protocol when this began, when we set our patient up. We've called out for someone to get the clinic instructor or coordinator, or Miss Douglas, our program director, right? So responder 1 has already gone to get them. Responder 2 then was instructed to get the emergency kit, and what else? Again, you don't need to write this one down, but what else are you going to get as the emergency as the responder number 2. You're going to get the oxygen, right? So let's say it's a Thursday. You all have started doing nitrous on patients. So we know the oxygen is running through the lines in the wall. So instead of grabbing the oxygen tank, right, we could just grab the oxygen cord, that big green one that plugs into the wall. Because we know it's Thursday and the oxygen is on. So while Twee is getting sat up and taking a couple puffs of the bronchodilator, that third person has also grabbed the medical emergency kit, right? Just in case Twee's inhaler isn't working, or she doesn't have as much in there as she thought. So we've got it as a backup. And then we also are going to have that oxygen ready so that second responders plugged that oxygen right into the wall, right? So that it's ready in case we need to. But let's say, Twee takes her bronchodilator, her inhaler, and she's feeling fine. She's starting to calm down. We're all staying calm, right? So we don't need to give her oxygen, but we have it in case we do. And then we don't need to call 911. So what if Twee didn't recover? She took puffs of her inhaler, we started oxygen, and she's still having a hard time breathing. Then we would call 911, right? If she's not improving, if that inhaler hasn't helped and she's still having difficulty breathing, we're going to call 911 at that point right away. Now, remember, who makes that call, right? It's going to be one of the clinic instructors or the director or the dentist that's going to help make that call. And who's going to be available for possibly helping if 911 needs to be called. Again, you don't need to write this answer down, but I want you to think about it. Which responder? It's going to be that first responder, right? Responder number 1 gets the clinic instructor, coordinator, director, or dentist. And then they also are kind of on standby to help with a 911 call if it's needed. Okay? Now, what's something else that we could have done when Twee announced that she told us that she had asthma, and say Twee didn't have her inhaler with her. And again, you don't need to write this one down. We could have set and should set out the inhaler out of the medical emergency kit. So we don't bring it to our room, right? Because there might be multiple patients in the clinic that could need the inhaler. But if we have a patient who has asthma, we're going to go set that inhaler out on the counter. So we're just going to open up the medical emergency box, take that inhaler out and close the box up and set the inhaler on the counter. That way we know that it's out. That also signals to all of the instructors that there could be a patient in the clinic that might need the inhaler. But if Twee has her inhaler, then we don't have to worry about that. And we already talked about this. I always get ahead of myself. If a severe bronchoconstriction occurs, right, where she's not responding to her inhaler, even with a second dose and second 2 puffs of the inhaler, what should you do? We talked about that. We're going to call 911. So what documentation would you note in the patient's chart when this happened? Right? So what are a few key things that we're going to note? We're going to note that we had a medical emergency, right? That our patient experienced an asthma attack in the chair. We're going to note like how many puffs of the inhaler were needed. We're going to note if oxygen was needed or not. And then, of course, if 911 is called because the patient is still having problems with that, we're going to note that too. And then we can note any other vitals that we need to, right? So if you have the electronic cuff, that can be helpful too, to help with documentation. But those are some of the key things we're going to document. So, what are some prevention strategies for future appointments for TWE? Right, we're probably not going to use sedatives when TWE comes in. Again, this is not common in like dental hygiene settings. Possibly if you're working in a dental practice with a dentist, they might use sedatives. Um, like anxiety medications too can be problematic for cases of severe asthma. And then we're going to avoid triggers, right? So we may try to figure out like what happened. Was it something that we did, or was it something that happened before, or was it not a trigger specifically? So another thing that we can experience in the dental setting is someone actually like having an airway obstruction. And so the best way to manage those possibilities are preventive type of things, right? Using our saliva ejector, using our high evacuation suction too, right? Our big one that we use with the ultrasonic in particular. And if we're doing like, if we're assisting, right, we're helping out in the practice with fillings or crowns and things like that. That's where rubber dams can be really helpful, because that way, if a crown or something like that slips, then it's not going to fall down their throat and the patient potentially inhale it. A lot of times, what will happen is they swallow it, which is a whole other problem on their part. But those are things to keep in mind, right? Because prevention is always our best strategy when it comes to emergencies, preventing the need to have an emergency protocol. Um, so let's look at a couple things here just before we get off, right? So on Wednesday, you do have a chapter 14 PowerPoint and a video. There is no flow chart. For this one, this is mostly focusing on like glaucoma, kidneys, and thyroid disorders. Really not like emergencies that are related to this, but make sure you listen to the lecture, make sure you read the chapter, because you are going to be tested on chapter 13 and 14 next week. Okay, so on next Monday, you have your last exam. Now remember, this is not a cumulative exam, but there may be a few things that I'll include on there that we've talked about. One of them being those hierarchy of controls. So go back to it's the tuberculosis and COVID-19 PowerPoints back at the beginning, and review those and your assignment that you did for hierarchy of controls. Make sure that you look at the notes if I made any notations on things. But remember, that the top hierarchy of controls are always our most effective. However, they can be the most difficult to maintain and enforce, right? So, like, elimination is physically removing the hazard. This can be really difficult. Substitution is replacing the hazard. Engineering controls, or isolating the people from the hazard. Administrative controls are changing the way people work. And then PPE is a lot, that has been a big focus on this last 12 plus months, or that personal protective equipment, which are very important. But the reason that PPE is not as effective is because you have to use it just perfectly for it to be the most effective, right? So when we can combine, a few of these all together, right? It's whenever we use multiple controls in the hierarchy of controls that we have the best effects. So I was going to give you a few examples, right? So this is from last spring. But here was some examples related specifically to COVID-19 way back in the beginning in April last year. So elimination at the time on a community level was like staying home and sheltering in place in isolation, sending certain employees home that don't need to be. So you're eliminating them from the potential of exposure. Substitution, and again, this is general sense, right? Not just dentistry, was remote work, right? So we were able to substitute things to avoid exposure to a virus. Engineering controls, right, are like partitions between workers, shift staggering, access restrictions. A lot of these are still in place in a lot of places. And then administrative controls are isolation and response policies, communication, education, social distancing policies, and then PPE, like the N95s, gloves, face shields, gowns. Those are things that would pertain to us. But go back to that PowerPoint and some of that information on there. I was going to give you another example. I mean, this is totally outside of dentistry, right? But this kind of helps, I feel like, make some mental sense. And this is why some of them are more difficult, right? So the hierarchy of controls in relation to bikes, right? So how do we eliminate a hazard to bikers? We ban cars. Now, is that the most effective way, right? But is that easy to implement? No, right? So maybe you can only ban cars in certain sections, right? You change the dynamics. You don't allow cars on bike paths, right? So that's an example of elimination. Substitution is people can walk, bike, or use transit. They still have their car, but they may also walk, bike, and use transit themselves. So there's just less cars on the road to be hazardous to bikes. Engineering controls, if we're isolating people from the hazard, so the hazard's still there, which is our cars, right, for bikers, but we can isolate them. So by adding curbs, I have no idea what bollards are, or barriers, though. We see lots of barriers, right, between even not just bikers, but people that are walking. Then a process, or these would be administrative controls, is changing behavior of putting up signs, educating people, enforcing rules also. And then also to protect us on our bikes, right? Personal protective equipment in this scenario would be like helmets. I have no idea what shame flags are. I'm assuming maybe those are like the little flags that, like, you know, that you can put on the back of your bike. It seems like a very weird name to me, if that's what that is. But here's an example of hierarchy of controls, right? That's totally outside of dentistry and healthcare. So, like I said, make sure that you watch the lecture and look at the PowerPoints and read chapter 14. You do need to make sure that you turn in your adult medical emergencies. That's through, why do I always draw a blank on this website? But the dental care, dentalcare.com CEs, right? So a lot of you have already done this, but double check your grades and make sure that you've turned this in. This is due soon, the end of the week. So make sure that you get this turned in by the 28th. So that is, I think, Wednesday. So make sure that's turned in. Yes, that is Wednesday. By Wednesday. So you have this to finish up instead of a flow chart. But make sure that you read chapter 14 because you are going to have a test on that. I also, test-wise, make sure that you know the medical emergency plan, right? So this is one that we had created and reviewed before. Remember how we had some confusion? This is still applicable, so you can review this, right? The rescuer, responder, responder 2, and responder 3. But remember, you also have that PowerPoint from the other day that we did. Was that just last week, I feel like? In week 13. No, maybe it was week 14. Sorry, week 14. My weeks are blurring together. Right, week 14, we talked about on Monday. Yes, week 14 on Monday. Your medical emergencies rubric, the medical emergency plan, and then there's the PowerPoint slides also. So review those for your test, and I will have a review sheet for you too. So in addition, right, to chapter 13 and 14, know your hierarchy of controls, and then make sure that you know your CNCC medical emergency clinical plan. Okay, so this is week 14 on Monday is where you can find these. Then the last thing we've got, right, is your final exam. Or not exam, sorry, final project. So when you're looking at your content, I know your screen looks a little bit different than mine, but when you're looking at the content, you can go to the flowcharts and medical emergencies toolkit. You can also get to this from your assignments. But if you go to the final project, and you're going to see this part. So I did add a list of flowcharts. So you've got these. And then, so you can make sure that you have all these. Remember the sensitive topics. If you don't have this one, you're not going to get marked off, but some of you did this for extra credit. You can add this into your medical emergency kit if you would like. When you come up, where did that go? All right, let's open your assignment. So when you're looking at the assignment here, you've got the template, and then you also have this toolkit tutorial. So this is just a video link that'll take you to YouTube. But you do have this template. So this is what I recommend you start with. And again, this is in the tutorial. But it has your kind of layout here, right? Your medical emergency toolkit. You're going to put your full name and your class number. You've got a blank page. And then remember that you have this reflective narrative. Now, you need to make sure this shouldn't be just 4 sentences. These should be, you should have at least a couple paragraphs where you're really reflecting on this project and throughout the semester. But you need to make sure that you hit these 4 points whenever you are looking at that reflective narrative. And if you look at the tutorial too, remember to include references if you used your book, or if you used other sources, right? So you can include references here if you need to. But do not forget your reflective narrative at the end. Now this is going to be multiple pages, and I want you to make sure that it looks good. Like you're going to be graded on that too. So this is your final, instead of a final exam, you have a final project. And this is worth 15% of your grade and is due on May 4th by midnight, because I have to have grades in by Friday of the last week of school. So this is due May 4th. A lot of your work is done already. You just need to copy and paste and then make sure things look good. That you have nice breaks on your pages, right? You don't want to have like, a chart then like break funny over a page. So just make sure that it looks good, that you like the way it looks, and you can turn that in early if you would like, of course. I don't mind if you turn it in early, just don't turn them in during other classes. And then reach out to me if you have any questions. All right. Everyone have a wonderful Monday, and I will see you on Tuesday. Oh, and don't forget to submit your answers from the case study PowerPoint. If you wrote them, you can take a picture on your phone and upload that. Or if you made a Word document or some sort of document, just upload it to the. You're gonna upload it to the class participation link for today. So you're gonna upload it. Let me just show you where that's at. So this makes sense because you haven't done here. You're gonna upload it here. Okay? All right. Have a great Monday, everybody.